Hello, how are you, Herman?
Good. How are you?
I'm good. Thank you so much for doing this. I know you have like 2 seconds off to breathe. I'm here with Herman Rodriguez. Uh,
Rodriguez. Yeah, you said it
Rodriguez.
right.
And you are working at which hospital?
I'm currently working at New York Presbyterian Weill Cornell Hospital, the Upper East Side of New York City.
And you are right in the middle of the front lines. You are right there with these brave nurses, administration staff, doctors, and it's pretty incredible. And I've known you for several years. So tell me about these amazing men and women that are there working tirelessly to save New Yorkers.
So I'm currently the director of oncology nursing at Weill Cornell, and we have amazing people that are with us. Although I'm not providing direct care, I round on the units, inpatient units, 4 inpatient units, and we have nurses aides, doctor, physician assistants, social workers, case managers, and we're all there. We get patients that are ruled out for the disease and other patients that tested positive. And it's amazing to see how everybody has come together and, providing the best care. And it's challenging times because, we don't know what we're fighting. We call it the invisible virus, right? It's a pandemic, and we're all trying to do the best and provide safe care for our patients. But the nurses and the doctors, everyone is amazing. They're fearless. They gown up, put their masks on, they go into the rooms. I just truly, truly admire their spirit.
It's so impressive. And I know, like, I get depressed feeling like I'm powerless and I can't do anything. And you're getting up every morning and running to the front lines and rounding the troops. You must feel amazing and exhausted at the same time.
It is tough. It is tiring. But every morning I wake up very early, and they're around 7:15, 7:30, rounding on the staff that need our support, and also on the other patients. Any patient that I find, and I do feel tired, but it's my duty. I took an oath when I decided to become a nurse. And for me, it's more than a profession. It's my duty just to help others. It will be very unethical for me if I don't do it. I cannot see myself doing anything else but serving. I want to live a life of service, and that's what makes me happy.
Yeah. I know for me, I would love to volunteer, but you watch the news, there's not enough of anything for like a layperson. I wouldn't know what I was doing, but I saw that they just don't have enough people just to take inventory at the hospitals. Because I live right near Elmhurst Hospital, which is really bad right now.
Yeah, that's bad there.
They have a refrigerator truck that they're keeping people on ventilators in. So every time I watch the news, I just think of people like you that I know, and I'm so proud that I know you. So how are you fearless? Is it just the oath, or is it just you don't even think about it? Everyone just runs in there to do it.
We just do it. That's our job. We don't think about it twice. It's just something innate in you, and you just go with it. I was just having a conversation with my mom on the phone, and she was telling me how she's so worried. They're praying for me, and are you taking care of yourself? And I told her, our organization, it's very protective of us. Just your comment, we have enough people helping us in our hospital. So we're very lucky that way. We have a lot of support. We don't want people to come. So whoever is listening to this, if you have somebody who's in the hospital, we have a no visitors policy right now, unless it's something of life and death. At the end of your life, if one of your family members needs you, then perhaps you can go and visit them. But what we're trying to do collectively is just to control the disease and have people to stay home so that we don't pass this COVID-19 to one another.
Yeah, well, I know a lot. I've talked to a lot of people that are in different parts of the country, and they're not taking it as serious. Because right now in New York, there's no way to not take it serious. I think getting the message out from people like you who are in the front lines, and thank you for your work. It's amazing. You mentioned your mom. Like last time I saw you, you went to Puerto Rico just a couple months ago because of the earthquakes. Your whole family lost homes. So people like you, nurses, doctors, your personal lives are put on hold right now. You don't have time for grieving. You just buried your dad. So you can't even think about that. You have to just go in and save other people, strangers.
Yes, it's been a tough year for me. I lost my dad January 26th. So I'm still mourning the loss because it's very recent. In a way, you're right. I just focus on trying to help other people because I know that that's what he would want me to do as well, just to care for others. But my mother was in Charleston, and currently yesterday she just went to Florida. My mother is 82 years old, so I don't want to see her, and I'm instructing her to stay away from me and stay away from other people. They drove her to Florida because, it's not good to take an airplane at this time and at that age. And she's there with my brother right now. So what we're doing, to stay connected and keep the spirits up is just FaceTime, like the way you and I are Zooming now. We do a lot of FaceTime. I have done cocktail hour with friends that I haven't seen in a long time to stay connected. We did that on Friday. It was a group of 7 of us.
Nice.
So you can be very creative as to how you want to stay connected. But right now, my priorities are my patients, to go to work every day and to provide care until we're over the hump and things are settled down.
Right. Well, even your partner left New York City. I have friends that did too. Your partner was like, "I'm going to Florida."
My partner left. he took social distancing to a new level. He isolated himself in Fort Lauderdale. We have an apartment there, and he's there now. We talk frequently, yes, but he's not here. I think he's a bit afraid to be around me.
Well, but that's what's amazing. You're not afraid at all. And for people, we're like, I'm young, I'm healthy, I'm invincible. We have to remind ourselves it's not about us getting ill and dying. It's about us giving it to other people, right?
Correct.
Giving it.
Yeah, because you never know. We have seen people turning positive at early ages, 30-something, 40-something, and it can happen to anyone. And you could be healthy today, but you might be a carrier.
Right.
And if somebody who's immunocompromised is near you, you might give him the virus. So it's better to stay inside at your house, sheltering in place, and only go out when you need the essentials for you, groceries, to the pharmacy. But I will say it's very, very important. Wash your hands all the time. Don't touch your face. Keep distance 6 feet or more from people, and avoid crowds.
Have you been doing any type of self-care?
So I have a routine every morning. I try to read. I light a couple of candles. I do some prayers. I do breathing exercises. In the old days, I used to go to the park very early and walk, but now I'm trying to go to work earlier. So I've been doing a little bit of that and trying to do breathing exercises, even at the elevator. Sometimes when I'm running around, I just said, this is the perfect moment to breathe. If I'm alone at the elevator, I close my eyes until I hit the floor, and then I breathe slowly. And today I was very lucky because it's really my first day off for many, many weeks. I just went to the park, observing social distancing. There was hardly anybody outside. And I did the lower loop, and I feel so much better.
Oh, well, good. Well, thank you for doing this. I know I feel so much better just knowing people like you and your colleagues are on the front lines and taking the time to do this on your day off. Thank you so much for everything, and also for being my personal friend. And you recently helped me through a dark time. I just happened to bump into you at a spiritual center. So whatever your spirituality is, faith or religion, I think this is a good time to play with that. I've been trying to meditate every day. Sometimes my head is going so crazy, and then I have to realize there are people like Herman out there taking care of us. I can take 5 minutes and meditate and heal. Thank you. Thank your colleagues. That's why I wanted to do this, is because I get so inspired. I saw the trash men the other day, just out there, with their masks on, taking up the trash. There's so many essential workers.
Exactly. And I don't know if you noticed, but here in the city, for the past couple of nights at 7 p.m., the whole street, the whole city, people are clapping as a thank you to, health workers and all the essential workers, as you mentioned, the bagger at the supermarket, the doorman, etc. And everybody is clapping. It's just really, really, for me, really emotional. Every time I hear that every day, I feel like crying because it's like a thank you. It's the best thank you can ever get. Like the thank you for the community, like communities thanking you for what you do every day. So it's really inspiring.
Well, you and your compatriots deserve the best thank you could ever get. So thank you very much and keep fighting the fight.
All right. Thank you, Bradley. Take care.
Thank you.
Ciao.
Today the devil whispered in my ear, "You're not strong enough to withstand the storm." And I whispered back, "6 feet back, mother effer."